am Dr. Jawahar, family physician and specially trained in diabetes. I am the director of Jawahar Hospital. Jawahar Hospital is a 24 hours multispeciality trauma and medical care hospital in the suburbs of Chennai. It's located in Tambaram, which caters all category of patients. Maybe it is a hospital with full-fledged consultants, staffs, and all paramedics for 24 by 7, which treats, helps in all segments of emergencies. It is in between Tambaram and Sanatorium. It's very close to GST Road, and it's easily accessible by all modes of transport. We have a dedicated infrastructure with 4-bedded emergency resuscitation beds. Our casualty has got all emergency equipments on par with tertiary care hospitals. So it is a 4-bedded emergency casualty department. It has got its own ECG monitors, ECG machines, central oxygen, central suction units, and an emergency care ventilator. So in case of any emergencies, maybe from a pediatric to adult, say a patient comes with acute chest pain. So we are here 24 by 7 to treat all the chest pain patients, say an emergency heart attack. Our casualty department is fully fledged to treat all your concerns and medical care. And our staffs are specially trained to treat all those emergencies. So our staffs are under the care of expert team of doctors. So we doctors are there, nearly some 35 specialists are there, and 5 family physicians are there. And we are spearheaded by our board of team of doctors, where we used to regularly conduct team events. So we used to conduct board meeting of our specialists in case of any emergency patients, any critical care incidents. We used to conduct emergency board meetings. And our casualty is also specialized to treat road traffic accidents. It's being very close to GST Road. We have a specialist trauma unit. So any road traffic accidents by means, we are very close to GST Road, and patients can always come here. And we have an fracture clinic 24 by 7. So our trauma unit is fully equipped with digital x-rays, and if any patient comes with a fall or accident, we used to treat them, suture them, arrest the bleeding, and any type of emergency care for accidents are there in our hospital. Our digital x-ray department is fully manned by 24 hours x-ray technicians, and we also have a portable GE x-rays. Our X-ray department is fully imported with high-end machines. We have got a portable GE machine where we can carry the machine in nook and corner of the hospital. So if any patient is unable to stand or unable to walk, those patients can be treated and screened by portable X-rays. So we have got a spinal cord treatment unit, we have got a head injury unit, we have got a fracture units, and all those these road traffic accidents, assaults, or any type of injury. We have got a dedicated orthopedic team. We have got 5 orthopedic consultants who are really experienced in this field, where they can really see the patients in no time. After seeing the patient, if any polytrauma, polyinjury or RTA come, we used to screen them, and if any fracture is there, we used to treat them accordingly with the orthopedician. And if any patients are not able to treated with a plaster of Paris, say POPs, if they have a severe injury, if the bone is severely fractured, so we used to do surgeries on them with the dedicated orthopedic team. We have got a state-of-the-art CM. CM is the latest technology in orthopedics, where it is used to fix the bones with plates and screws. So our operation theatres are fully equipped with CM and operation theatre tables, lights, everything is of state-of-the-art facility. So once the patient is stabilized, if they really need a operation to fix with plates and screws, we used to do it immediately at affordable cost. So that is very important. So we used to give this type of treatment on par with tertiary care at affordable cost. That is the speciality of our hospital. And cardiac care, we used to stabilize the heart attack patient with all those thrombolysis injections. We used to shift them immediately to our dedicated intensive care unit in the second floor with lifts. And there we have got a 6-bedded intensive care unit, fully manned by trained staffs, intensive care unit doctors and critical care specialists and cardiologists on call. So our cardiologists are very well experienced in this field to treat heart attacks. So in no time they will be here and they will be at the backup team for our duty doctors, ICU staff nurses to give instructions and to console the patient. Once this heart attack patients are being thrombolized, stabilized, so we used to counsel them. We have got an excellent counseling team in our hospital by the way of counselors, diabetic educators and our staff nurses are being trained in that way that they really heal the patient by their counseling way of treatment. So if any patient is first treated by emergency in the casualty team, they will be shifted accordingly to the respective rooms or the general wards or deluxe rooms. After that, they will be given appropriate treatment by the duty doctors or the specialized consultants. We have got a panel of 33 specialist consultations in our hospital, from pediatrics, gynecology, arthroscopy, orthopedics, cardiology, vascular surgeons, physicians, intensivists, and urologist, general surgery, dermatology, and we have got a lot of specialists in our hospital. It is about 33 departments of that. Our main aim is primary prevention. So we used to screen the patients whether if they are 30 plus or 35 plus. So we used to screen the patients according to their family history. If any family has got a cardiac ailment or diabetes in their family, if they are 30 plus, we used to screen them once in 3 years. So our hospital main motto is prevention is better than cure. So we used to counsel them and ask them to do these master health checkups. So our hospital is supported by dedicated computerized clinical laboratory, digital x-rays and ultrasound scan. So this diagnostics plays an important role in screening all those patients for primary prevention. For example, if a patient is 30 plus and in their family they have got diabetes, heart attacks or any other cancer diseases, so we used to tell them, your family has got this problem history and you are at risk for developing these diseases at any stage in a very soft and in a very convincing way. And we see that these people and patients are being screened once in 3 or 5 years for these deadly diseases. So we have got a separate team for them to accommodate, to explain and to clarify them. And with this ultrasound scan machine, digital X-ray, computerized ECG, laboratory, which works 24/7. Our lab technicians, X-ray technicians and scan doctors are fully trained in that. So in that way, we play a huge role at the Dr.Jawahar Hospital to treat and screen you first, whether you will be developing this disease in future. So this prevention part is very important for our hospital. So we used to tell our patients or people who really consult us to do all these preventive health checkups. We have got 5 in that. First is master health checkup. It's a health checkup which is planned to treat, to screen, to see, to diagnose whether this patient has got any problem in any of his system, say a cardiovascular system, respiratory system, her gynecology system, his nervous system. So whether this patient has got any problem in the system or whether any of his system will have the problem in future. So we have got a master health checkup in system, and next is comprehensive health checkup. This comprehensive health checkup, we do all this master health checkups test along with echocardiogram and cardiologist opinion or any other special tests, so that accordingly to the patient's symptom, we do not miss any diseases. That comes under comprehensive health checkup. Next is diabetes health checkup. It is specifically designed according to the protocol for the diabetes patients. So usually diabetes patients will have a problem in the nerves in the leg, foot. Sometimes they will have some silent problem going on in their kidneys. Say they might be throwing out protein or albumin in their kidneys. So those patients will be screened in the diabetes health checkup. So we used to do all the complications which are all anticipated in this diabetes population. We used to screen them. By screening the diabetes patients, we will come to know what stage he is in. Because we all know diabetes and hypertension are silent killers. So if we are going to pick up these silent complications early on, say 5 years back, 6 years back, if you are going to pick up those silent indicators, it will be a great job to save one life. So that is what we Jawahar Hospital doctors are here to screen a patient, to prevent the disease 5 years before, 6 years before, whether this patient is going to have heart attack after 4-5 years, whether this patient is going to have kidney diseases some 3-4 years after. So all these future predictions will be screened. And next checkup is well woman checkup. We have got a gynecologist team who will always screen their female patients above 30 years, whether this female patient will have breast cancer after 3-4 years or 10 years later, whether she is at the risk of developing breast cancer, whether they have got a family history of breast cancer. So all these histories will be asked, recorded, and investigations will be planned accordingly in our well woman package. We have got a mammogram with scan machine to screen all those patients, and we do cervical smears regularly with a gynecologist to know whether this patient will have this cancer symptoms, cancer signs in future. And we also have 24/7 labor wards for delivery patients, antenatal cases. So all this comes under this package, well woman package. So apart from this, we have got a cardiac package. cardiac master health checkup, where we used to do all the tests related to the heart. So we, Jawahar Hospital, with a team of specialist, and me, Dr. Jawahar, a specialist in family medicine with special interest in cardio, diabetic and critical care. So under the cover of our specialized consultants, overall expertise in their respective fields, we used to plan the treatment according to the protocols. So we have the main motto as tertiary care at affordable cost. So we, Jawahar Hospital team, usually see that we used to have primary prevention than cure. And apart from this, last to say is we have got a dedicated operation theatre, state-of-the-art operation theatre, twin semi-modular operation theatre. So there we have done lot of surgeries for the benefits of nearly 4-5 years back. We did an orthopedic surgery for 96 years old female who has got a fracture in her hip. She couldn't walk and she came to our hospital. Our orthopedic team of doctors saw her and she was advised to go for surgery to prevent bedridden status. And relatives, their relatives are doctors, and they have asked us whether it's possible to do surgery at 96 years. We told them that this female octogenarian is walking previously before to this fall. She has got hypertension, she has got cardiac problem, atrial fibrillation on treatment. In spite of those complications, we spoke to the doctors, attenders, assured them that we, Jawahar Hospital, has got a dedicated trauma team, orthopedics team. We have got an arthroscopist and we have got a dedicated semi-modular operation theatres. And they told that they had a lot of confidence on us. Okay, doctors, you can proceed. We did this surgery at 96 years, and surgery post-operative event was very much uneventful, and she got discharged at the 10th day, and she celebrated her 100 years, and it was a grand function. So we were very happy, and the patient relatives are very happy. So that is the teamwork of Jawahar Hospital. So we used to tell the patients which patients will be benefited by the surgery. We used to select. So right selection we used to do. We have got a board of doctors. We have got a dedicated surgeons, cardiologists, anesthetic team. And they used to grade the patient, the risk factors, mild risk, moderate risk, high risk. So accordingly, we would plan the treatment according to the protocols. So comprehensively, we do some holistic approach from casualty to operation theatre. We have got the protocols in place, we plan accordingly, and we have got a pharmacy where we used to have 24/7 manned by staffs. And our staffs are really precious in the sense they used to assess our patients under the doctor's guidance. They used to counsel them, they used to clarify their doubts also. And we have got a counseling room for the patients. So if a patient is in a critical stage admitted in our hospital, if the patient's attenders wants to know more about the disease, more about the prognosis, and more importantly about the cost. So all those factors will be decided and addressed to them in our counseling room with camera and audio in place. So that it is a mutual agreement between ourselves and the patients. And that is apart from all this treatment and infrastructure, we have got a 30-bedded hospital. We have got two separate blocks, A block and B block. A block is fully occupied by the deluxe rooms. Very spacious deluxe room where they don't feel as if they are staying in the hospital. that is typically styled and architect by our hospital architects. And we have got a B block for some budget people where they want the state of the art facilities at affordable cost. But in B block also we have got an AC room, non-AC room in place. And we have got a surgical intensive care unit, medical intensive care units, and we have got a septic ward in place where some infectious cases will get admitted there. And our pediatric and gynecologist team is in place where they used to treat all those gynecology patients, pediatric patients, and neurology patients like strokes are also getting admitted, and they are all successfully treated. With they are coming with paralysis, we are giving an excellent treatment here, and they are going back with all smiles. And we have got a complete holistic approach for a disease. So apart from this, we do home health services for senior citizens and people who are all not able to walk out of their home. So we used to hear a lot of facts and stories. So now people are staying in third floor, fourth floor without elevators. They are in steps. In those cases, we have got a separate team for home health services. Even doctors, staff nurses, paramedics, drivers. If a patient calls them, in no time they will be there. Midnight also we used to go and attend to any house or home calls. So our ambulance is ready, available 24/7. We've got 2 drivers in position throughout the day, even in odd hours. That's very important. So senior citizens or any palliative care, old age people, they couldn't come to the hospital. If they call our home health services team, our team will be there at your call. So this is the way of functioning of Jawahar Hospital at Tamram. So I used to tell our staffs and all of our doctors, treat with a smile. And the main thing is tertiary care at affordable cost. Thank you all.